Welcome to Greater Boston Urology, Destination Dedham. My name's Les Kavicki. I'm the Chief Operating Officer. Greater Boston Urology, an organization that began in 2011, has 19 urologists serving patients from all over New England. We have built this particular location to provide subspecialty urology care in many different fields. So our goal here is to be able to refer patients to Dedham in order to ensure that they receive the quality care that they need in an environment that is comfortable and easy to get to. Today we're here to show you around Destination Dedham. We want you to be able to see our women's health area, our ultrasound suite, and our infusion area. You'll be surprised at how inviting a urology practice can be. Let's take a look. In the process of working with our architect on the original design of Destination Dedham, we recognized that many of the patients who come to Greater Boston Urology need special accommodation. We installed a large elevator that brings patients up from the first floor to the second floor, where Greater Boston Urology has all of its exam rooms and treatment rooms. There are two waiting areas in Destination Dedham. One is designed to accommodate men's health and general urology, and the second waiting area is specifically designed for the women's health program. We have 4 welcome stations where patients can check in. The welcome stations are designed to allow the patient to have a family member or friend with them while they are checking in. At the same time, the welcome stations have glass partitions to ensure everyone's privacy. The goal of Destination Dedham is to be a hub location for Greater Boston Urology. We have 9 care centers from Metro West Boston through southeastern Massachusetts, including Cape Cod, and these locations all send patients to Dedham. In order to provide the right quality of care and to have the most contemporary technology and expertise available, it's important to focus all of that effort here in Dedham. It's an easy location to get to. Patients don't have to go to Boston, and there's plenty of parking. This particular location has 15 exam rooms, 3 procedure rooms, an ultrasound suite with 3 rooms, and an infusion area. This is the men's health and general urology wing. It was designed for patients to have significant privacy as well as significant comfort. This particular area can accommodate 6 physicians and 4 nurse practitioners during the course of any given day. We wanted to be able to accommodate a larger number of doctors and physician assistants so that we can see patients on a very timely basis. Patients do not need to wait to see a urologist very long, usually less than a week or so. Greater Boston Urology diagnoses and treats prostate cancer every day. It's one of the most prevalent issues pertaining to men. It is the number 2 killer of men after cardiac disease. This particular equipment is our 3D fusion biopsy equipment manufactured by Philips in Vivo. There are very few private urology practices that have the capability to utilize this equipment for prostate cancer diagnosis. The reason this is important is because we utilize MRI imaging to help us identify specific cells that we're concerned about within the prostate. When the patient is here in this room, the MRI image is married to the ultrasound image on this machine so that we can actually biopsy the exact tissue that we're concerned about. That makes this procedure much more accurate and allows us to diagnose much more quickly and ensure an appropriate care plan for each and every patient. This is the infusion area at Destination Dedham. It can accommodate up to 3 patients. The reason infusion was important when we designed the building is because pharmacology for the urology practice has changed dramatically over the last few years and continues to develop. We now have new drugs specifically for metastatic castrate-resistant prostate cancer that actually extend a patient's life up to 4 years. This particular facility is designed to help those patients receive that medication. We will also be infusing radium, and we'll be infusing IV antibiotics for patients who need those specific drugs. This is the Women's Health Wing of Destination Dedham. This new subspecialty program was developed based upon needs that were identified for our female patients within the practice. By having women's health at Destination Dedham, all of the urologists in the practice can refer female patients for specialized care at this location. The Women's Health Program is headed by Dr. Angel Marie Johnson. She's a fellowship-trained urogynecologist, originally trained at Massachusetts General Hospital. Greater Boston Urology recognizes that female urology diagnoses and treatment are very sensitive areas. The Women's Health Division here at Destination Dedham was designed for patient privacy and clinical excellence. Women do appreciate the fact that this urology practice has been able to seclude this type of care in an area that makes them comfortable. Thank you for taking this video tour of Destination Dedham at Greater Boston Urology. We're very proud of this location. We would be honored to care for you, your family, and friends if you have any urological needs. For more information about our practice, continue to explore greaterbostonurology.com. I'm Les Kavicki.